is Catherine. Welcome to Double O Kidney. If you want to fight chronic kidney disease and hypertension, there are 5 foods you have to absolutely add to your renal diet. The foods of today's top 5 are the heart-healthy staples that can help you fighting hypertension, the main reason the kidneys of a lot of people get damaged. Your kidneys and heart will thank you. Bonus, along with other healthy lifestyle choices, a heart-healthy diet may reduce your risk of heart disease or stroke by 80%. Now, before getting to our top 5 of the day, there are a couple of comments here I want to read you very quickly. This one is from Joy Bolina. Hi Catherine, your videos really helped me a lot. From CKD stage 4, now it's only stage 2. I'm getting better. And she also says what she's doing to improve. Just follow your doctor's medication and with a proper strict food diet. You will definitely lower your creatinine. Watch all the videos of Miss Catherine. It really helps, including her recipes. Hi Joy! I'm really happy about your improvement and I'm incredibly glad to know that I help you. This kind of positive mindset is one of the best things people can bring to this world. Comments like yours are the reason why I'm here today. So, thank you and God bless you. And I wanted to say hi to Beatriz Montenegro too. She always comments my videos and I really appreciate that, so thank you Beatriz. And by the way guys, I always read all your comments and answer them whenever I can, so don't hesitate to write. Because you, the community, is what makes Double O Kidney great. And there is another comment I want to read you. Here, from John Broderick Sullivan. Thank you very much, Catherine, for your videos. I've started an heart-healthy diet following your advice, and I've also got the program from your video, and I was able to lower both my blood pressure and my blood pressure medications. And I know those pills are hard on the kidneys, so now I'm eating less salt and less processed foods, and I'm eating better, and I'm waiting for my blood test to see if there's an improvement in my GFR. What more can I do to improve my renal health? Hi John! Thank you for your comment. I think you're already on the right track to improve your kidney function. And I think your blood analysis will tell you that. But don't get discouraged if your analysis doesn't show an improvement in GFR, because kidney disease unfortunately is a chronic condition. This means that if it's in the advanced stages, it's hard to get a lot of kidney function back. But not impossible. So don't give up with the heart-healthy diet. Taking care of your heart is really important for your kidneys too. And watch today's video because these 5 foods are really great to fight hypertension and are perfectly suitable for a kidney diet since they are very low in potassium, phosphorus, and sodium, the enemies of the kidneys. So, time for our number 5. This is a superfood with some impressive health benefits. It won't just boost your heart health, its vitamins will help to reduce high cholesterol and high blood pressure. And it's pomegranate. You may have already heard about the incredible health benefits of pomegranate juice for kidney patients. This juice is so full of antioxidants, vitamins, and phytochemicals that just drinking it in a small amounts daily can positively impact the health of people on hemodialysis. This is what a recent study conducted on kidney disease patients of the Western Galilee Hospital in Israel says. So basically, patients drank a small amount of pomegranate juice every day and their blood pressure was reduced at the point that they were able to take fewer blood pressure medications. The study demonstrated that drinking pomegranate juice can also lead to improvements in lipid and cholesterol levels, key indicators of cardiovascular health. Because of its high concentration of antioxidants, consuming pomegranate juice may decrease the risk of kidney patients developing cardiovascular disease. So, spread the good news, send this video to anyone you know that may benefit from a diet that's healthy both for the heart and the kidneys. But why is heart health and high blood pressure so important for our kidneys? High blood pressure is not just the second leading cause of chronic kidney disease. It is also caused by it. This means that almost every single kidney disease patient will have to face hypertension and find a way to control it. And not just them. 1 in 3 Americans suffers from hypertension actually. This is where the heart-healthy diet can help us. A heart-healthy diet that can lower your cholesterol levels and your blood pressure is strongly recommended to improve your kidney function. Actually, heart health is strictly correlated with kidney health. You need to have a strong heart to improve your kidney function. Literally. The heart and the kidneys are part of the same system, and the kidneys need the heart to work well to be healthy. And this is where the heart-healthy diet can help you. And as a nice bonus, a heart-healthy diet may reduce your risk of heart disease or stroke by a whopping 80% according to several studies. Heart-healthy diets aim to reduce the chance of developing heart and circulatory system diseases and include low-salt diets such as the DASH diet, dietary approaches to stop hypertension, and Mediterranean diets that are mostly plant-based, high in fiber and low in saturated fats. Now, to make this diet suitable for people with kidney disease, we need to also consider other factors because not all the healthy foods are healthy for kidney patients. Yes, pomegranate juice is great for your heart, but there is just a problem. If you are in stage 4 or 5 of kidney disease and you have a potassium allowance, you should consider that a single cup of pomegranate juice or 250 milliliters has 500 milligrams of potassium. This is not bad if you are in stage 2 or 3 of CKD, but if your doctor told you to limit potassium, you may think that 500 milligrams of potassium for a single cup of juice are too much. Remember that most patients in the advanced stages are told to have no more than 2,500 milligrams of potassium per day. That's why I'm recommending you to add to your renal diet some real pomegranate instead of the juice. We're talking about the real fruit here. Pomegranate has just 205 milligrams of potassium and 32 milligrams of phosphorus per half cup, or 87 grams of aerols, the juicy seeds of the pomegranate. So you can get the benefits of pomegranate juice without risking getting too much potassium from a single glass of juice. Now, remember that if you want to try adding pomegranate to your diet, you should consult your doctor first. This is not because this fruit is dangerous, just because if you have kidney disease and are taking medications, you should talk to your doctor or dietitian before making any significant changes to your diet and lifestyle, okay? Time for our number 4 now. This one will make everyone think you are a chef when you'll add it to your cooking. And it's also healthy for your heart and kidneys. And it is number 4, leeks. Leeks belong to the same family as onions, shallots, scallions, chives, and garlic. All these foods are very healthy. Leeks look like a giant green onion but have a much milder, somewhat sweet flavor and a creamier texture when cooked. They are gaining popularity not just with health-conscious people but with top chefs too, due to their very particular flavor. Now the interesting part. Leeks are nutrient-dense, meaning that they are low in calories yet high in vitamins and minerals. This is what makes them heart healthy. They are particularly high in provitamin A carotenoids, including beta-carotene. Your body converts these carotenoids into vitamin A, which is important for vision, immune function, reproduction, and cell communication. They're also a good source of vitamin K1, which is necessary for blood clotting and heart health. They're also very low in potassium, just 160 milligrams for a cup or 89 grams, and phosphorus, just 31 milligrams as we can see here. And if this wasn't enough to make you consider leeks in your renal diet, leeks are also a rich source of antioxidants. Antioxidants in leeks fight oxidation, which damages your cells and contributes to illnesses like diabetes, cancer, and heart disease. Leeks are a particularly great source of camphorol, a polyphenol antioxidant thought to protect against heart disease and some types of cancer. Also, leeks are in the same genus of garlic. The genus is called alliums. Several studies link alliums to a lower risk of heart disease and stroke thanks to allicin. Allicin is what makes garlic one of the best heart-healthy foods in the world. But leeks are rich in allicin too, so they have the same antimicrobial, cholesterol lowering, and potential anti-cancer properties garlic has. How to eat them? Leeks' mild flavor works well in vegetables-based dishes. So thinly sliced leeks in olive oil and a small amount of vegetable broth. Then garnish with chopped basil immediately before serving. Or use leeks in crustless quiche. They pair particularly well with mushrooms and red peppers. Okay, time for our number 3 now. This superfood is an excellent source of omega-3 fatty acids. It's rich in antioxidants, provides fiber, iron, and calcium. Great for your heart and your kidneys. Number 3, chia seeds. Why are chia seeds so healthy for you? Omega-3s. Chia seeds are one of the best plant-based sources of omega-3s. The lipid profile of chia seeds is composed of 60% of omega-3s. Now, this benefit alone is worth including them in your renal diet. Blood sugar regulation. All foods that can help lowering glucose levels should be more present in the renal diet of people with kidney disease. In particular, chia seeds can even lower insulin resistance. Chia seeds are a great ingredient for a smoothie, but can be digested whole, unlike flax seeds, another very healthy source of omega-3s. Chia seeds don't need to be grounded to be digested, and a very good source of dietary fiber and manganese, good for healthy cooking. They can also be used to replace eggs in baked goods and other preparations. They form a gel in water. Using this gel instead of eggs can lower the cholesterol in your diet and increase the nutrient content. So if you have a recipe and you're wanting to get egg-free, because eggs are so often connected to food allergies and food sensitivities, do 1 tablespoon of chia to 3 tablespoons of water. Mix that and it can replace an egg in a recipe. Very useful also for vegan cooking. Omega-3s provide a host of multiple health benefits for patients with advanced kidney disease. Omega-3s have been found by recent studies to be able to lower hypertension as much as lifestyle changes such as exercising more, cutting back on salt, or limiting alcohol. But most of all, they have been proven to actually lower creatinine levels in people with kidney disease. So adding omega-3s rich foods is a must for anyone with kidney disease, in my opinion. Okay, our number 2 now, a staple in the Mediterranean diet that all kidney patients can benefit from. Let's see what it is. Olive oil. Extra virgin olive oil is one of the healthiest fats you can eat, especially if you use it to replace less healthy oils in your cooking. It's rich in monounsaturated fats, and it's basically what the Mediterranean diet is based on, which provides numerous health benefits for your heart and kidneys. Studies link extra virgin olive oil to a reduced risk of heart disease, brain cancer, and other serious health conditions. Actually, olive oil can be what's making the Mediterranean diet so good for the health of your heart and kidneys. This is what a large Spanish study reported. Olive oil is so powerful in fighting inflammation and diseases thanks to oleocanthal. Oleocanthal, the source of olive oil's distinctive aftertaste, has been shown to have similar anti-inflammatory effects as ibuprofen, a widely used anti-inflammatory drug. Buy extra virgin or virgin olive oil because they are higher in antioxidants. Use olive oil to make salad dressing, for dipping bread, or for marinating vegetables. Keep in mind that extra virgin olive oil offers greater anti-inflammatory benefits than those provided by more refined olive oils. What's more, monounsaturated fats are stable at high temperatures, making olive oil a healthy choice for cooking. Olive oil is very low in sodium and potassium and phosphorus free, making it a great option for people with kidney disease. Frequently, people with advanced kidney disease have trouble keeping weight on, making healthy, high-calorie foods like olive oil important. A quick recap before we move on to the number 1. So, our foods for today were pomegranate because it's proven to help people on dialysis. Number 4, leeks because they have allicin like garlic, but they are also delicious. Number 3, chia seeds may be the best plant-based source of omega-3s. Number 2, olive oil. And our number 1 is maybe the healthiest food ever if you are a kidney disease patient. You can eat it frozen as a refreshing snack or fresh or put it in a smoothie. But before I show you what it is, there is something I want to tell you. If you have kidney disease, you should know that there are ways to get your kidney function back. A lot of people here on Double O Kidney are using this program like John from the comments I've read you before. So if you want to beat kidney disease, click here for more info about this program. And our number 1 is blueberries. Blueberries are good for your heart, kidneys, and the rest of your body. Blueberries are packed with nutrients and are also delicious. This is all for today. Thank you for watching.